Hi,
Hi, how's it going?
good. How are you?
All right. It's
Good.
nice and Kate, right?
Yeah, thank you so much for taking time to do this out of your busy schedule.
Oh, I'm sure I'm happy to do this. These can usually be fun. We're gonna have fun, right?
Yeah, we're gonna have some fun.
All right.
How's your
Kate,
day today?
oh, everything's going okay. Are
Good.
are we live or are we recorded or how's
I'm
this?
recording. Yeah, I'm
Okay.
recording. Yep, so we're good. We can shuffle
Okay.
through later and I printed out our little questions and so I'll just kind of veer off that keep me on track with asking you different things and that kind of stuff.
Okay, Kate, that's
Yeah.
awesome. Thank you so much for sending those out. It always
Oh,
really
of
helps,
course.
right? Kind of think through it ahead of time
Yeah,
and
totally. I hope it's not too much either. I mean, we'll just continue to roll in the conversation, but um kind of a backstory. We started this nonprofit when Logan was diagnosed. He was around 2.5. So 2021. Um and my husband and I just kind of jumped right in and we're like, what can we do? How can we make a difference? And this is just it's a lot to process and I also have a brother who's 45 who has intellectual disability. Autism is part of his diagnosis as well. So I've kind of been around it my whole life. And I feel like I knew pretty early on something like was not right with Logan. Um, I knew developmentally there were some things going on and we were kind of thrown through the ringer with testing and cerebral palsy and MRIs and sedation, like so many things. And uh, it wasn't until he was, yeah, almost 2.5, I looked at one of the speech therapists and I was like, I keep asking about autism and no one's helping me get him assessed. And she was like, I see what you're seeing and I'm going to put in a referral. Like our resources here at Kaiser like can't help you. He needs other, earlier intervention. So, we finally got that diagnosis and um got him in all of his therapies early and I mean within a year like just the amount that he was talking and engaging in the behaviors that reduced and all sorts of things. We did the whole genetic testing and we checked for Fragile X syndrome because my brother Josh mimics kind of some of
yeah.
those personality traits that kind of
Yeah.
coincide with that. And my mom never had him tested. Things were so different back
Oh yeah, we didn't even
in the
have
day.
then. Yeah, we had
Yeah.
testing for Fragile X, but even that wasn't great back then.
Totally. Yeah. So Logan actually he carried one of the X chromosomes that caused developmental delay, but I didn't carry the other
Yeah.
matching X chromosome. Then my dad had testing done. He didn't carry it. And then the next of kin would have been like, I think to go down my brother, like the rest of the male bloodline on my side of the family. And we just kind of stopped at that. Because to me, it wasn't going to make a difference, right?
Yeah.
And there's a lot of, I think, misinformation put out there about autism and how you get it and the vaccine. I mean, there's just so many things, right? Like genetics and everybody's hyper focusing on all those things instead of the other things, the educating themselves, the how can we help these individuals
Totally
that
right, man.
need
Like, how is
extra
my
things.
child gonna live their best life? Like,
Exactly. Yeah, I know
yeah,
that
man.
it's daunting to hear your child has a disability, right? Like you don't know what the
Yeah.
future holds, but we're strong in our faith and so we just believe that this is what God had planned for us and like
Yeah.
this is our journey and Logan is Logan and I would not change him for the world and I really breaks my heart when I see families that just don't have the support or the knowledge after they get that diagnosis to feel that confidence like I can do this and there's people that Autism Awareness Month hits and like I don't want to bring awareness like I make vaccine manufacturers liable, do this, do that, and we're just so hyper focused on those things that we really can't control. Like
Yeah.
what's done is done. We cannot control every aspect of
Hey,
our lives, our kids' lives, like what happens to us. I mean, there's so many things. Can you imagine like a world that had not one person that was intellectually different? Like that's just how boring. right? Like,
It's, one out of six individuals has a developmental disability. And we always said it's the one state that doesn't discriminate. It doesn't discriminate based on age or
mhm,
race or
yeah,
income, right? I
yeah,
mean, we know for
yeah,
autism and really for all developmental disability, it can impact any of us. And really, most of us are going to move and hopefully in and out of a category of disability at some point in our
totally.
lives. It's a car accident or cancer or Parkinson's,
Uh-huh.
or do you know what I mean? And
Yeah,
when we
yeah,
do adult health care, we see people all the time that got older and even the most simple, kind of straightforward things, diabetes, overweight,
yeah,
congestive heart failure, they get on meds and they go from not being able to walk 10 steps to being able to they get exercising again and they go back to a pretty good level of activity and sometimes
yeah,
drop meds. But if
yeah,
you can't walk more than 10 steps, you're in a disability category, and
yeah,
much less if you've had a stroke or something more,
absolutely.
kind of how we traditionally think of disability or just a
Mhm.
bad car accident. And people
Yeah,
move in and out of those categories. And most of us at the end of life, we're going to experience some of it or we'll experience it with our parents and things
yeah,
too. It's just I have this poster outside of my office that's a beautiful really like happy smiling child. You can't see who's holding him, but you can see the hands. He's like a 2 year old, and it just says disability is a natural part of the human experience, and I always keep it there so all our trainees can see it. And
yeah.
does that make sense? It's just
Uh-huh. I love that. I absolutely love that. I think that's one of the things I think about often when obviously news outlets and politics have been
uh,
a topic of discussion with autism lately, and the stuff you see is just it's hard to take in as a parent, right? And a lot of it's coming from
yeah,
people that don't have a child with a disability. And I don't want to discredit people's thoughts or opinions, but I feel like people just need to be, again, more aware of what it is and that
yeah,
people there's different levels of a spectrum, and I know we'll get onto that later, but
yeah,
there are people, yes, that are very low functioning that are going to have some additional struggles in life, and that doesn't mean that they're not going to find something that's going to let them thrive or be who
that's
they
right.
are. And there's kids that are going to be super high functioning adults that hold jobs. And I mean, right, Elon Musk, right, came out and said he's on the spectrum, and
Totally.
he's
I'm
absolutely
happy to
incredibly
talk about that too during the podcast if that'll help. I wanted to tell you I have a hard stop at like 2:40 at the
okay.
latest, maybe a little before,
Okay,
but and I just wanted to make sure I said that, but I'm sorry.
perfect.
Okay.
No, you're totally good.
Okay. Yeah,
But
that it's
just
a
wanted
really
to,
important topic, what you're getting at, and I'm happy to talk about that too as we go through too.
yeah, totally.
Sure.
I'd love to just let everybody hear like a little bit of your background, kind of how you got into this and all that, just for their reference.
Okay, great. Yeah, I initially worked with kids really even through high school. I did some coaching, and then in college, I got really lucky and I had applied for this position at my university's Institute for Human Development. This is all the way back in 1988, and very few states had early intervention programs back then. So if you had a child with Down syndrome or autism or intellectual disability, there weren't always birth to three services like there are now through early start or early intervention. And so people came to my university in the psychology and education department. And I had just seen an ad for a graduate assistantship. And I always liked little kids, but I was 20. I wasn't a graduate student. And I applied and I got hired as a paraprofessional where I worked with psychologists, speech pathologists, occupational therapists, and I really just kind of took data and ran the curriculum. So if a child had language goals, I would work on them with them. And it was really just a lot of play with children that were 2 and 3 years old that had different kinds of developmental differences. Down syndrome was common, certainly autism was common, and cerebral palsy then, and spina bifida. And then not long after that, I worked at a crisis nursery for kids that had trauma. And then I worked at a camp here in Napa called Enchanted Hills Camp for blind and visually impaired youth and adults. And I did that for a couple of years and decided to go to med school. And then, I actually took a Navy scholarship because I needed to find a way to pay for med school and was lucky to be able to do pediatrics. And believe it or not, the Navy has really great, we used to call it neurodevelopmental pediatrics programs because they care for service members' children that are all over the world. And so I would get to, and I did training. I trained at the Mind Institute for developmental pediatrics. I did a pediatrics residency first, and then stayed in the Navy for a number of years, really for 22 years,
Wow.
and was at one point was a division chief where we ran a large division in Virginia for service members' children with disabilities and neurodevelopmental differences. And then I was in charge of I was they called it the specialty leader for developmental pediatrics for the Navy. And then finally I was the Surgeon General's advisor and specialty leader for all children's healthcare for the Navy for a few years, and then retired and came back to the Mind Institute, where I'm the medical director and the chief of developmental and behavioral pediatrics. And then
That's
my clinical
awesome.
specialties are focused on pediatric feeding disorders that many children with autism have, but then
Mhm.
also with
Yep.
other kinds of neurodevelopmental disabilities, and autism, Down syndrome, and then especially in creating health system trainings and supports that decrease the medical trauma that many kids with developmental differences experience when they go in for blood draws or surgeries or vaccines even, by training providers to understand developmental differences and provide more supports and help kids learn to participate in their healthcare better.
That's wonderful. I love that. Thank you for your service as well. It's a lot of years put in. Thank you. And that's a great story. And I love how, how in depth that is, to get you where you were today. You've done a lot. You're well versed. I love it.
Yeah, that 22 years in the Navy felt like 22 years for sure.
I'm sure it did. I'm sure it did. Well, I think again, going back to like talk about education and knowledge of what autism is, I think the biggest thing is just helping people really like understand just the basics of what is autism, and just kind of explaining that to them, and in terms of brain function and developmental differences, kind of how you would describe that compared to a neurotypical individual.
Yeah, that's a great starting point because we hear so much about autism in the media now or on socials or just, from friends, et cetera, that if your child covers their ears when there's loud noises at a basketball game, or they maybe shake their hands a little bit when they're really excited, you can start to wonder if your child has some of the features of autism, especially when
Mhm.
they're really young.
Yeah.
But those are secondary features, things like sensory differences, even restricted play, where your child really only likes, say, trains or cars or lines things up. Um, those are, or if your child, has a restricted diet and is really picky, those are secondary features of autism. And we do need to have some of those symptoms to make a diagnosis. There's
Mhm.
four things that are secondary, and we need to have two of those four. But the primary features, and you have to have all three of these, include differences in social and emotional reciprocity. So that's basically just being connected.
Mhm.
And that can look like things like eye contact, but in the most kind of straightforward example is when your child's very young, say they're 12 months old, and you start to do itsy bitsy spider or wheels on the bus. Do they smile with you? Do they look back at you? As they get a little older, do they start to imitate some of the gestures? When you roll your hands or do patty cake, do they move their hands as well and look at you and smile? So that's the reciprocity.
Mhm.
And then the two other areas that we see are you have to have deficits in nonverbal communication. And that's just all the things you do other than talking when you're communicating with someone. It's
Yeah.
not just eye contact, but it's things like nodding or shaking your head or leaning in. Or if someone's too close to you and maybe they're saying something that they've been going on and on about a topic and you're ready to be done with it, the way you lean back or even put your hands up to indicate that I'm ready to end the conversation.
Mhm.
Those are the parts of nonverbal communication that we all need to be successful in taking our roles in life. I always tell our students that I'll stop when I'm giving this example and say, look at you, all of you right now are in the room, you're sitting, you're nodding, you're making good eye contact. Because you're students, right? You're in receive mode, and I know what that is. That's what I expect a student to do until I pause. And right now, I'm excitedly talking and trying to use more gestures and alternating my inflection and maintaining good eye contact so that, because that's my role as a
Mhm.
teacher. And we all just do these things effortlessly for the most part. But they're pretty tough for kids with autism and adults with autism. You can learn to do them over time, but they often take a fair bit of effort. So we said nonverbal communication. We said the social reciprocity, and then the third criteria has to do with developing and maintaining relationships. So friendships, relationships with your family, and that can be everything from just being able to move through the regular stages of development where you're, 1.5 to 2 and you play next to kids, but you check in, you see what they're doing, you try to imitate it. They roll a car, you roll a car, up to, taking turns with your friends, learning to do things like share. And then as you get older, relationships means you have things in common and you like to do the same things, By the time you're in middle school, it's really about trust and will someone have my back and be there for me? And then that evolves, kind of throughout life.
Hmm.
But to make a diagnosis of autism, you have to have difficulties with all three of those areas: nonverbal communication, social emotional reciprocity, and developing relationships.
Okay. Yep. I think that's key for people to understand. It's very cookie cutter. I remember the pediatrician asking me when I asked about Logan, does he like to be touched? Does he make eye contact? Those very basics. And I
Yep.
was like, well, yeah, he does. He's extra affectionate. He makes eye contact, here and there, but I mean, those are just such basic things to have to try to use to get a diagnosis. It is so much deeper than that. And I think those are the things that people really weren't seeing early on. I remember people telling me, he doesn't seem like he's autistic, or I don't know, or maybe he'll grow out of it. And like, all these things. And I'm just like, you just have no idea what it is like living in our day to day and like the things that go on, behind the closed doors and the behaviors and things. And so people just it's hard to it's not something you can just see on somebody, right? Like it's so much deeper than that. So I think that's huge to understand. And then the next part of that is the whole spectrum, you kind of get categorized: high function, low function, level, the different levels, and kind of how does that work?
Yeah, Kate, that's first of all, that experience you had, it's so hard and frustrating for parents. And I'll tell you, it's hard for pediatricians too. You have a 15-minute visit and you're trying to do all the things you have to do, and then you sometimes tack those questions on at the end, or you just get one look. Maybe he's
Yeah.
just quiet and doesn't do a lot during that. And so, we just really have to listen to families. And I'm sorry that that was hard at first for a while. Um, so the spectrum, years ago, not that long ago, even maybe 8, 10 years ago, we had these different classifications. You've
Hmm.
heard of, Asperger's syndrome or pervasive developmental disorder not otherwise specified, PDD
Yeah.
and OS, even a thing called childhood disintegrative disorder, which we would now it would be we now know what caused a child to really have regression almost all the time with genetic
Hmm.
testing and imaging, the way that we've advanced.
Yeah.
But those were all lumped together. And then we had autistic disorder, and they were all together but separate categories. And it turned out that over time, if I put you in the category the first day I met you with, like you said, one look on the day of diagnosis, if I said you have pervasive developmental disorder or autism or even Asperger's, the outcomes weren't all that different over
Hmm.
time. What really mattered was your response to intervention in the first year. So if we could get you diagnosed early, get you into high quality speech therapy, occupational therapy, therapies like ABA or other intensive behavior supports, and help your parents and everybody, grandparents, all the people in your life understand what autism is and how to support you, that most kids would do better.
Yeah.
About 80% would make progress. And so we've shifted to now saying it's all autism spectrum disorder. That's the only thing, but it makes it simpler. There are all artificial categories, frankly, that we're making anyway. So let's
Yeah.
make it simpler for families and clinicians and insurance companies and everybody else. And then we just talk about low or high support needs, and we're kind of even moving away from that a little bit. But
Yeah.
I do want to talk about that because there are still levels in the DSM, level 1, 2, or 3. And when we see kids with level 3 being the most support needs, when we make a new diagnosis in a 2.5-year-old, sort of by definition, they're going to be level 3 because they need high support because we're going to refer you for intensive therapies, if you met diagnostic criteria. But that doesn't mean that they'll be in the high support needs category 6 months from now, much less 10 years from now. And I
Absolutely.
think that really worries families when they get a level 3. Or maybe it's you explain that with one caregiver, maybe mom or maybe mom and grandma, and then dad sees it when he goes home and is looking on the internet at 11 at night, and it gets confusing and scary, for
Hmm.
folks. So I think the big thing to understand is just um, that level 3 just means the amount of therapies we want you to do now. And sometimes we do make a level 1 diagnosis in like an 11-year-old that we think could just use a little speech therapy and some help with social interactions with their peers.
Hmm.
But most of the time, we make a level 3 diagnosis at the time of diagnosis. Does
Yeah.
that make sense?
Yep, absolutely. And that was kind of how it was with Logan. Being so young, they gave him a level 2 diagnosis, the speech, the language, and all that. But,
Yep.
diving into the diagnosis and the evaluation part of things, like having, there's a lot of, I think, talk out there about like, not wanting to diagnose your kid at a certain age and having a label and all these things. But if we're not open to these conversations, right, when it comes to our kids, and we're not getting them those early interventions, it's, setting them up for a little bit more of a struggle as they're getting older, right? Like that, like I feel like that early diagnosis is so important, and just being able to let them start those services, catch up as they need to, and like you said, you don't know what the future holds, but starting those things early can change their needs significantly as they get older. And I've already kind of been firsthand witness that with Logan too, which has been great. But
It
um,
is great, right? When you see
yeah,
that change, because you put in so much work. I know
totally,
you have, if you were able to get
totally.
that, and then to see it start to pay off and to see them be successful, I know it's hard when I'm with families on day one with a 2.5-year-old and they've been worried and they've
Yeah,
been holding that worry for a while already, and then they finally get to meet us to know what it looks like when you're 5. And we try really hard. We have a family navigator program just to pair them with a family that's a couple years ahead, in the journey so that they have an understanding of that and they can just see another child and that's doing pretty well and have that parent say, boy, 2.5 years ago it was just like what you're going through, or maybe even
yeah,
more challenging,
yeah,
and so I think that thing about, we have this CDC, the Centers for Disease Control's autism screening program or initiative is called Learn the Signs Act Early. And we do developmental screening at 18 and 30 months and then at 24 months in your general pediatrician's office and look for autism now. But that only started in 2006. And before that, we did all just wait. And the most
yeah,
common thing, pediatricians really were not successful at diagnosing anything except motor delays. If you didn't walk by the time you were 16 months, we all knew what to do with that. But with all these other things, we would wait and wait and wait, and then kids would get diagnosed at 5, and they'd be much further behind at the time of,
yeah,
trying to get through school, right
yeah,
away. And now we know 20 to 25% of kids that we diagnose when they're little, 2 or 3, are ready for at least that percentage, or ready for a general education setting, by the
yeah.
time they go to kindergarten. And that's a step in the right direction because it was so few before.
It is, yeah. And, not to discourage any families that do get that later diagnosis, there is still so many services and
That's right.
resources, and they have time to catch up. And it's, I don't want people to feel like, they have to have those early diagnoses, but I think just key as noting why we do have the ability to diagnose earlier and how that can be beneficial, and to understand that part of things too, instead of having again opinions and assumptions, or oh they're too little, or oh they're
Yeah.
they're that's those things are all they are little, and their little brains are developing, and it's a great opportunity to get them into speech or OT, and help them succeed. I don't want people to feel like it's this malicious, you know, therapy that they're going through. It really is just so helpful for them socially, um, to help them, grow and develop, as they kind of should. And again, and they're going to do that at their own pace anyway, right? Like we're going to set goals and we're going to have things we want to meet, but at the end of the day, like we all grow at our own pace, and it's going to be the same for them, and just trying to be patient in the process and
Yeah.
having that community to lean into. I love that you guys have that partnership program. That's something that Kaiser didn't have when Logan got diagnosed. And though I had a brother, with a diagnosis, him being so much older, like I didn't really know what I was walking through. And I worked in pediatric dental for six or so years, and I had a passion again working with kids with special needs. So a lot of my patients were special needs patients. But so you see it, you hear stories, but it's just different than having that community. And so it's another reason why doing this. And I have some other, things up my sleeve I'd love to do and start here in our community to help those families. I actually met with our ABA therapist today, and her and I were talking about that, how there's just no sort of support group for families. So being able to offer that and have those support groups when you get those diagnoses super early is so important.
Yeah, I couldn't agree more. And, we've even learned over the years that some specific groups, like we have a group called Sankofa here that supports mostly African American families. Others can come, but it's just because the experience is always like culturally situated too. We have 2 other groups that support Latino families and mostly Spanish speaking families. And there's a lot of folks here that are Dari speaking or Ukrainian speaking. And
Yeah,
development's always cultural, it's always situated
absolutely.
within your culture, what the
Yeah.
expectations are, what your mom's going to say, what your mother-in-law's going to say, all of that. And
Yeah.
if you sometimes you need support around all of that too. And we have a group that supports parents of teens and young adults because things are different when you're at that age than
Oh
when you're,
yeah.
you know,
Yeah.
and the
Yeah,
resources are different, the systems are different, and the best whatever psychiatrist in town is probably going to be different, in that age group. So
absolutely.
yeah, or therapist, yeah.
Absolutely. Well, kind of going back to the diagnosis part of things, we kind of said autism average age to get diagnosed is around 18 to 30 months, right?
That's
Um,
when we want to see kids diagnosed. The
yeah.
average age still kind of widely varies depending on if you're in a rural area, if you're from a traditionally marginalized population, Black,
Hmm.
Latino, non-English speaking, you're more likely to get diagnosed later, still
Yeah.
as late as up to five, still in a lot
Hmm.
of parts of the country. But we're seeing in California more and more kids around three, before three, and
Yeah.
but any like you said before, whenever folks get in, that's okay, but we are seeing kids younger now.
And I think that's another huge topic of discussion too, is people think that there's this giant influx of kids getting diagnosed and labels and all these things put on these kids. And what is your take on that? I know we touched on vaccines, we touched on some of those things, and when I think about it, I think that our technology, like you said, has evolved. We have learned, we have become much more aware, um, and again, it is not a negative thing to be diagnosing these kids. It's helping them be the best versions of themselves and getting the support and the care that they need. So, as far as that topic kind of goes, how do you feel about that?
Yeah, I mean, so a few things like we know really definitively that there just isn't any evidence yet to support vaccines being causal for autism. And it makes sense to me that people would worry because most kids present, 15 to 18 months is when it starts to become more clear. You're doing so many shots in that age group.
Hmm.
But when we think about vaccines and the exposure, the real thing is how much vaccine protein is in that vaccine. And our vaccines are so discreet now. When I was first in training, you'd get a diphtheria, tetanus, and pertussis shot. I mean, we saw kids, even when I was a general pediatrician for a couple of years, all day long with big swollen arms, and they would
Hmm.
react to it because that single shot had more vaccine protein in it than all of our shots combined that we give at
Yeah.
this age. They're just refined, and smaller and smaller. So biologically, it's just not that plausible. But the other things are, it makes sense. Like he just had a batch of vaccines, and now I'm really noticing, or she, all these differences. So I know why families worry about it. But
Yeah.
I mean, it has really been studied extensively from small studies to population-based studies all over the world as well, by the way, not just in America.
Mhm.
It hasn't shook out as a cause. And if it had, I think, 30 years into this, we'd have done something by now.
Yeah.
The other things, though, we know that being older as parents, we have a longer environmental exposure throughout our life.
Mhm.
We everything from, I'm not mentioning any of these things as specific causes, but just things from the chemicals in whatever, your toothpaste,
Absolutely.
mouthwash, to pesticides in your environment,
Yeah.
to like we know all those things can turn genes on and off. And we also know from some really elegant studies that looked at identical twins, which, if it was if autism was solely caused by genetics, if one identical twin had autism, the other should too, because they're the same. If it
Yeah.
was just, if you have the gene, you have it. But that's not the case. There's only about 90% concordance, 90% of the time one and the other one. And then siblings, where the association is if you have one child with autism, the sibling has a 10 to 20% risk, depending on the study we look at. And then we looked at fraternal twins, and that was a study done by Kaiser and Mind and some other groups in Northern California about 10 years ago now. And fraternal twins had rates, depending on if it was a boy or a girl, between 50 to 70%, which does tell us that some environmental exposure that occurs during pregnancy, nothing moms could ever do anything about, but an exposure that could be as simple as a viral illness or
Mhm.
some other exposure is likely causal, and we call that, or causal, likely contributes to
Yeah.
autism susceptibility.
Yeah.
And we call that epigenetic effects, and that just means when you're forming the really complex neural networks that help you process sensory inputs like sound or develop language, things like that, that those networks get turned on and off. You have the blueprint, the genes form, but the development could be overdeveloped or underdeveloped during pregnancy and early childhood. And we think that that's where most of the causation it probably is. This
Yeah.
autism susceptibility plus environmental effects makes you, more likely to have
Yeah.
a child with autism.
Well, and just like any other, you mentioned that earlier, cancers,
Yes,
I mean, there's so many environmental factors that if we just absolutely cannot prevent things in general from happening. I mean, you can get in your car
that's
and get
right.
in a car accident, pass away. Like we cannot control, like we can't be blaming and trying to control every little aspect of things that happen to us in life because there's so many factors we can prevent. We can make changes in our homes, like you said, we can choose to do chemical free. People choose not to vaccinate. Those are all personal choice. And
Right.
we know that there's risk to anything. We know that there's risk to getting a flu shot as an adult. We know that there's risk to, taking medications. There's risk to chemo treatment. There's risks for everything. And so I feel like that part of this this cultural thing that's being kind of talked about with autism needs to just be understood because it's just one of my biggest pet peeves is just understanding like we're so hyper focused on this one, autistic part of the community that are doing absolutely no harm to society. Like so
Yeah.
many contribute and have something amazing to offer, and we can be taking, different steps and just using our energy to be doing so much more than just hyper focusing on who we should blame for it and looking at it as this negative thing. And, it's very sad. It was really sad when they came out and said how, tears families apart and it ruins family. It's like, that is just such an awful thing to come out and say.
And so antiquated too, I mean, there's so many autistic individuals that are living great lives and that enrich the
Absolutely.
lives of their family members that
Yeah.
sometimes they're the number one favorite person in their family,
A
and
hundred
they
percent.
don't really enjoy being with
Yeah.
them. I'll tell you, at the Mind Institute, we were originally founded by families for families. Families did a big
Mhm.
fundraiser and they needed
Yeah.
services and they did what families have done all over the world, try to get together and
Yep.
get scientists together. And our original mission was, I hate even saying this now, but it made sense at the time was to find a cure because the
Mhm.
idea was, like you were saying, a lot of what you read back then was, Autism Speaks had even had a commercial kind of saying those things that,
Yeah.
destroys lives, it'll tear your family apart, things like that, that we know better than now.
Hmm.
And but our mission has shifted from that, and our stated mission now is to help people live their best lives.
Yeah.
That makes all the sense in the world to me. And there's two parts of that. One is like skill building and getting more comfortable, and
Hmm.
developing a communication system and learning all these things we all have to learn: how to wait, how to transition,
Yeah.
how to be
Yeah.
friends,
Oh
all
yeah.
that.
That's
But
hard for all of us.
totally right. And then extra supports are needed in certain
Hmm.
areas. In other areas, you might have real strengths. You might be great at anything from math to history to science to. I saw someone this week who I love that can, in his head, track all the motions of the solar system, of the planets in the solar system, and
I
write
know
it out for me in relation
it's
to each other.
incredible.
I can't do that.
It's incredible the intelligibility of some of these individuals that are, autistic is just insane. I mean, my brother has this crazy like sense of direction. Like you could drop him off in another state and he'd find his way back home. Like he just knows where he's going. And my little Logan, he's going to be an engineer or something one day, and he loves dinosaurs. Like he could tell us about every dinosaur and their names. And it's like, I can't even remember what I did yesterday half of the time.
It's impressive, right? And we're
It's
both
just
laughing because
crazy.
it's fun
Yeah.
also. And this
Yeah.
guy was cracking me up all day yesterday with the things he was telling me about. And I think that's that, like I find my interactions with autistic individuals very enriching. And
Mhm.
I always have almost always have a good time. Sometimes people are really
Yeah.
struggling, but and seeing the progress, when I see somebody that was referred from the emergency room because they were in so much trouble and about to be
Mhm.
hospitalized, and a couple years later they're doing great,
Yeah.
really in every way, that's really a pleasure. But I will say that I think that's one of the tricky things for families is it usually is over a longer time period. It's not like an ear infection where you take antibiotics
Yes.
and it takes a while to
Yeah.
learn the skills,
Yeah.
and you've got to get the support needed. And unfortunately, with all of our systems, it takes a while to get to the right supports. And in
It
some
does.
places, it's really hard,
It is. Yeah. It is. And I don't want to, never want to discredit family. I know that it's hard. It's hard. It's so hard
Mhm.
it's hard to cope with. It's hard to understand. It's hard to get services. It's the whole thing is hard. We have such there's good days and there's bad days. And, but just encouraging families that, you know, are feeling that way and really struggling. And it's not always rainbows and sunshine. There are really hard days and that's part of the journey. And it's gonna, you'll get through it and
Yeah.
this too shall pass. There's building that community for me is another reason why I want to do what I'm doing, because I want people to know that they're supported and they're seen and they're heard and they're not alone in this journey once they get that diagnosis.
And Kate, the last thing I just say, because you're doing such a beautiful job of, thinking about where people are when they hear the news, and everything we're talking about, we kind of go through grieving stages, right? And it's normal to
Absolutely.
do some denial, then it's normal to be mad, then it's
Yeah.
normal to sort of negotiate, and then to
Yeah.
get to acceptance, and then to get moving,
Yeah.
and if you can do that with your partner or whoever else is in your support system
Mhm.
together and get moving as soon as you can, whatever
Yeah.
that takes, we just it's really nice to see families at the other end of that, when they start to
Yeah.
move.
Yeah, it does. It comes in waves. I felt that this morning. Logan had another ABA assessment, and I'm like, I felt overwhelmed. I was like, another, pe more people coming in to assess him, and do this and do that, and more questions to fill out. And then it was just it again. We got through it. It was fine, and I'm fine now, and it's gonna come all the time. Been through with school. Every day is so different. Some days he wakes up and the whole day is just behaviorally challenging and it's hard. And then some days we wake up and we have these great days and he's thriving and you know, it's seasons. So there is so much good that can come out of it and just trying to stay positive.
Yeah.
Um, let's see. We talked about the diagnosis and evaluation. I think something else that is another topic that I hear often is autism in boys versus girls, kind of how that comes up. You see it more so in males, right, than you do in females, and um, how how can families kind of better clinically be more aware of more subtler signs when it comes to those kinds of things and the differences between, females and males when it comes to autism?
Yeah, and that's a really important question, and it's a good question too, because we still have a lot of data there. You'll look at in a website or even an academic paper that'll say autism occurs at a rate of 4 boys for every girl. You'll read things like that,
Hmm.
and that number's been declining, and people then wonder like, well, are girls more susceptible from environmental or other reasons? And I'll be honest, I think we just missed it in girls for a really long time because it looks different. And what I mean by that is, we have differences in they're not universal, and I hate to be too stereotypic, but the typical presentation of girls with
Hmm.
ADHD is often more inattentive and a little more anxious
Yeah.
and a little more closed down and masked than we would see in boys with ADHD that
Hmm.
stand out in the classroom because they're talking all the time, they're interrupting, they're on the move, they can't stay in their seat, and
Yeah.
you just get attention for that earlier than you do for these internal symptoms.
Yeah.
See sort of more internal symptoms is one way to think about it in girls. And where we typically see challenges are around communication, especially once you get into third, fourth grade and middle school. And the challenges are often related to the things I was talking about earlier, social reciprocity, where you are making friendships, but beyond. And it maybe goes well if you both are into whatever, My Little Pony. You have a shared interest. But if your friend starts talking about their emotional state, or they want support or emotional support, or they're giving you subtle social cues about, yeah, I want to quit talking about that and move on, or I want to go with these two friends, but not that friend, that kind of thing,
Hmm.
you really miss a lot of that, and maybe
Yeah.
just not see it in the same way that your peers might be seeing it. And those issues around relationships can be tricky. The other thing is that girls seem to be in really several studies. We don't have a great standard instrument validated for this, but they'll mask more, just meaning that it's a term that we're using to kind of say that they'll conceal how they're feeling to get along in social situations and
Yeah.
maybe just smile quietly, but not interact when they're not sure what to do.
Hmm.
As opposed to maybe a boy would talk and talk about, sea animals that he's interested in, even
Yeah.
when everybody was clearly ready to move on, and his
Yeah.
friends, even they said something and they remind him. And so there's a lot of subtle differences in presentation like that. And I think if you're concerned, and a lot of times, by the way, the supports aren't as we don't need as much support as well too. You can learn these things around social skills and something called perspective taking, which is just when I'm talking, I look at my conversation partner and I
Hmm.
think, are they interested? Are they
Yeah.
nodding, making good eye contact, or are they not interested in this topic without them having to tell me? Like those
Mhm.
kinds of things, or is that person frustrated or are they surprised? These are like subtle things that are not easy to sort out if you have autism. And we can teach them though, and kids can learn tricks to get through those situations. And so that's why we started to make the diagnosis in girls that had less severe symptoms, but still really benefited from treatment,
Hmm.
because they'd be more successful at work and in relationships and in friendships. And, I always thought like we'd have kids that, well, okay, they're really bright and maybe they're going to be an engineer someday, and, which is great. I'd like them to have the social skills to be a manager if that's what they wanted to do. And so
Yeah.
that's why we still do the work, even
Yep.
for kids like the kind of kids I'm talking about now. Does that make sense?
Yeah, absolutely. I think that's great for people to understand and for people to know too. And, like you said, not to be too cultural, but there are there are differences in males versus females. The boys, like you said, the testosterone level in the boys and the sitting still, and like they present stuff so differently than girls do at an earlier age. So I can see how it is definitely harder to diagnose that.
Yeah, yeah, for sure. But definite benefit from treatment. We have support groups for like preteens and teen girls. And there's been a long-term study here called the GAIN study that includes neuroimaging. And
Hmm.
it's really been neat to see those groups, because we know also that folks with autism, there's been some nice studies about social outcomes, and even autistic individuals that really learn to do well socially in most settings often benefit from having an autistic friend where they could just really relax and it's
Yeah.
easier, and you can, and that's a nice thing that we see in those social groups too.
Yeah. I love that. So again, going along with the diagnosis, what is usually the first step you recommend families take once you do give them that diagnosis? I know you guys offer some support groups and things like that, but what's kind of the first thing you suggest?
So it depends on what's been done by their pediatrician before they come. What the academy guidelines are to make sure that hearing is okay before we even make a diagnosis. Not every child has to have a formal hearing test, but they should have had at least a newborn hearing test where they passed, and not a lot of risk for hearing loss after that. Not a family history, not recurrent ear infections. We just want to make sure you're hearing really well, especially if it's a little kid, if it's an 18-month-old, 20-month-old that's kind of prelinguistic. And then once we've done, so sometimes we'll refer them to audiology. We generally make referrals to in young kids under age 3. It's called the Early Intervention Program. Every state has an early intervention program. In California, it's Early Start through the regional centers.
Mhm.
And that's awesome because you can get in-home support services where someone comes to you, looks at what you have to play with, what your toys are like, what you know about autism or just development in general, and they coach, just meaning help you think like your child can do this right now and this right now and this right now, and 2 weeks from now, let's add this in, and it could be a different skill, a different toy, and then you'll be reassured that you're on track and you're doing the best that you can, to move them along. And the early intervention teams, one, it's free. It's in
Mhm.
your home, so you don't have to travel. And if you have other children, it can just be really hard to go to appointments all day long, as you
Absolutely.
know.
Yeah.
And then you get speech, occupational therapy, an early childhood educator who's just a specialist in education for kids under 3, and physical therapy. And you don't always get all those services, but you might get early childhood educator and an occupational therapist. But the early childhood educator would say work on language goals. And then when
Hmm.
your child gets a little older and you really got to work on pronunciation, speech would come in and help. And so that's number one. And then the second thing is we do make a referral for almost all kids, certainly young kids, for ABA. And there's some different types of ABA. There's a model that's pretty common in this area called Early Start Denver model. And I should say intensive behavior interventions more than ABA, but someone who understands autism, understands social communication, communication and play, who can help you as a parent and work directly with your child. And that's usually, it can be as much as 30 hours a week. There's not really clear evidence that more than 20 hours a week is better, that 25 is better than 20,
Yeah.
but there is pretty good evidence that at least 8 to 10 hours is really helpful, especially in that early stage. And sometimes it takes a little while to ramp up. Your child might only tolerate an hour or two, at
Hmm.
first at a time. And then once they turn 3, it's great if in your area there are preschool programs that are inclusive, that have typically developing kids and kids with developmental differences together. Because at 3, speech therapy and occupational therapy switch to the schools. And so, and you can still get it under insurance, but it's just harder. It's easy to go to your neighborhood and to have some speech therapist come into your child's school, and maybe you want to do private speech therapy through insurance as well.
Yeah.
But it's nice to have that as a baseline because you're going to go to school every day, so you can do that. So those are the main things. And then the medical workup, is we talk to every family about genetic testing. There's a tier one test, which includes testing for, it's called DNA sequencing for Fragile X syndrome, and then a chromosomal microarray, which really looks for they're smallish, but now we think of them as decent sized deletions or
Mhm.
duplications, so extra or missing pieces of DNA that can contribute to autism or developmental delay. Um, and then sometimes, if your child, say, had seizures or had autism and a kidney problem and a growth problem, or had multiple medical problems of any way, congenital heart disease, for example, then we'd recommend definitely recommend a referral to genetics for consideration of other testing. They can do whole genome sequencing now, which is all the way down to the single gene, one gene being
Yeah.
changed. But honestly, those are the primary recommendations, and we do connect families to family navigators or our social work team to help them
Hmm.
navigate through it.
Hmm.
Um, and it's easy for me to say that, it can take months to get through it all, and honestly, most often it takes about 6 months for people to get through each of
Yeah.
those stages. And I want families to know that they're doing okay if they're
Mhm.
knocking one thing out a week, or even they're making phone calls and getting on a wait list, and then moving forward. That's sometimes the best you can do, even though it's
Absolutely.
frustrating. But it is it's good to know you're doing all you can do, and we have a checklist written out, and it says things like that. It says, I have called the regional center. I have gotten a call back. I am on a wait list. I've scheduled an appointment, because it's when I first talk to you and say your child has autism, you don't understand how
Hmm.
much work it's going to be. Now how much
Yeah.
work
Yeah.
did it feel like that? Like that, setting up all those things was a lot of work, I bet.
I mean, I was handed the diagnosis in a packet, and it's like, here you go. And I had to call Kaiser and like, I don't know what to do. I don't know who to call. Like, I called the regional center because he was young. They helped me. The developmental pediatrician outside of his primary pediatrician was so helpful. She sat down with me, and we were at Kaiser, and they had said, we unfortunately lost budgeting for this program. We used to have a support group, and we don't have it anymore. And then I was like, I'll run it. And it was, so many logistics in it, but like at that point, even I hadn't even figured out Logan's stuff. And I was like, I don't want anyone to feel like I felt, and I want them to have the support. But yeah, I mean, it's a lot, and it was a process. It takes, a couple months, and you feel discouraged. You don't know what to expect or what's to come. But I think, from my experience, the best piece of advice I could try to give would be to find other people in the community, whether you have a connection to support groups or not. Get on, social media groups, excuse me, and just try to connect with other families and talk about it. And I think another thing that doesn't get talked about enough for families that do get these diagnoses isn't the mental health part of things. Like, I transparently have struggled really hard with a lot of anxiety and some depression, and there's been seasons where I've just felt like I've hit rock bottom, and I have gone to see a therapist. There's family therapists that offer services to families who do have kids with disabilities that can help you process that information and support you. And I'm another huge advocate for mental health. I think it's something that's not talked about enough, and it is something that is important when you are caring for a kid with a disability, because there are so many things that come with that. And it's helped me a lot to be open about that and my needs, and just talk to somebody that um not necessarily personally, that's not going to judge how you're feeling. And
Yeah.
so that's just a little snippet of my advice for families that maybe while they're in the waiting phases, they could start to taking care of the caregiver, taking care of themselves, so they can be the best they can be to help support their child, because it really is a lot.
Yeah, I think that's really important. Earlier, you were talking about finding your tribe too, and sharing the information early with people that you think are pretty likely to be supportive, even if
Mhm.
it meant like, I've had families tell me like, oh, I can't call my mom yet. Like this is just going to be a lot more emotional work for me, but I'll do it next week. But
Yeah,
if I talk to my sister first, I know she'll help me and have my back.
absolutely.
And that's really important example of like just basic self-care, and kind of thinking through that, because you don't I don't know. Most families, so more than half of families feel some anxiety and depression at some point, and people get through it, and you get
Yeah.
support. And you did it exactly the right way. And then when you start to get in these success cycles, it'll feel better.
Mhm.
But I always do talk with families about it. We had a long talk with somebody just yesterday about accessing services, and it can be tricky to get, adequate mental health services through insurance. And our teams generally help with that. Our social workers will kind of try to connect you and find out who's in your plan and that kind of stuff. And it's also hard for a lot of people to prioritize themselves because they'll say, well, of course I'm sad, but he needs or Logan needs,
Mhm.
all these things, and I only
Yeah.
have some capacity, so I'm going to do all these things. But I think maybe you were kind of getting at this that taking care of yourself increases your capacity to be able to do all those things Logan needs, and we just forget that step sometimes. And even things like finding a gym where your daycare will work for your
Mhm.
autistic child,
Yeah.
so that you
Yeah.
can just get back, you get it 45 minutes, 3 or 4 times a week, or even an hour, or even if you don't really work out that day, you can just sit and, I don't know, pay a bill or some of the things that are piling up so that you
Yeah.
get a little more capacity.
Mhm.
All of that, I think, is really helpful. And it took me a while, frankly, to learn to talk to families about that, when
Yeah.
to really understand what they were going through, and
Absolutely. And there's other, kind of elaborating on some of the supports in childcare. And when you do look at some of the regional programs and some of the community supports, there are programs that offer respite care and some funding that will help you pay for childcare. They can place you with caregivers who are versed in the disability community, who have experience taking care of kids with disabilities. And that's any level, not just autism. I used to have caregivers come in all the time when I worked at the general office with kids with cerebral palsy and feeding tubes and
yeah.
there are things out there. Just ask, advocate for yourself, talk about what you need and what kind of community support you need, and there are people out there that will help you kind of find those services and get access to that.
That's right. I mean, the regional centers in California will cover respite. The military program covers respite. There's a lot of groups that can help with it. And there's something called in-home support services.
Mhm.
They have a thing called protective supervision. If your child's really at safety risk, if you're not
Yeah.
watching 24 hours a day, nobody
Yeah.
can do that 24 hours a
Oh
day.
yeah.
And so, there are programs to provide caregivers or to pay someone it can be too, as long as they do a background check and things.
Mhm.
And the other thing that's really nice is the regional centers now cover therapeutic recreation as well. And that's,
Yes.
a gymnastic class, a dance
Mhm.
class, a horseback riding group, things like that. And for me, when I talk with families, sometimes there's wait lists and you still got to navigate it. But when they're doing those activities, folks will often really brighten up and go, oh my gosh, you should have seen him on the horse. And it's just a chance to have kind of, typical positive experiences and talk to other
Absolutely.
families that are doing it too, and to get a break, at the same
Absolutely.
time. So each one of those things, I think when you're in that stage where you're overwhelmed, feels like, one more thing I have to do.
Mhm.
But a lot of them end up, contributing, being very positive.
Absolutely. Yeah, that is important to touch on too. The community-based programs, that's huge. And giving our kiddos an opportunity. I was uh, totally transparent. I was always very reluctant to put Logan in extracurriculars. I didn't know how it was going to look. I didn't know how he was going to be perceived. I was even hesitant to enroll him in soccer this season because I think about, sport parents can be brutal. And I
Yes.
think about the parents on the sidelines, like just yelling at this poor kid or seeing that he's not, because I know it's not going to click. He's not going to necessarily pick up on which way the ball goes. And so I'm like, mama bear mode, protecting. And then I'm
Yeah.
like, you know what? Just breathe. Like what people think doesn't matter. He should get an opportunity to play. Letting him go out there and enjoy himself, it gives me a little break and I get to watch him find a little bit of joy in an extracurricular activity and who knows, he might just take off and thrive. Logan is in karate right now and he loves it. Um,
Great.
he just you talked on hearing and Logan also just recently was diagnosed with the auditory processing disorder. I kind of have questioned his hearing for a long time. Genetics said that we also have a chance of having a child with hearing impairment. So I've always been in tune with that. And long story short, we're trialing an FM system and it's been night and day for him. And he is like thriving in his sport right now. He loves karate. He's in the back of 12, back row, 12 kids, and he can hear what she's saying and he's following along and he's engaged. And it's just, it's giving him something, that excites him. And I think that that's important too. If you have the capacity to try to still encourage your kid, whether they're wearing their headphones out on the field or to a game, like just letting them experience different things in the community for their sake and your sake too, to let them, you know, kind of get a feel for what that's like as well. And it also is so important to teach other kids about other kids with disabilities. That's another thing that I want to start doing. I want to start talking at schools and educating kids. And one day I hope to write a little kids book about inclusion and something sweet to kind of teach kids. And I think that's the kind of last thing I want to touch on is like why it's so important for people in our community to understand autism, that don't have a child with autism, teaching our children, the bullying, the thing, all those things. I think that's so important. And so, kind of what some advice that you would give to families that don't have a family member or an individual with disability that they should know.
I mean, just in the most basic way, just be kind and generous and just recognize that. I mean, it might be you in that situation. And we talked earlier before we came on about how 1 out of 6 individuals has a developmental disability, and
Mhm.
it's a category we all sort of move in and out of, throughout our life. And it's a normal, natural part of the human condition. And so recognizing that somebody might be processing information differently, or they might need a little more time, or hear directions, like you said, with FM support so that the distractions are minimized so they can focus a little more. And then I think once people see the kind of joy that occurs if you go to a Challenger baseball game or a Special Olympics event, or I was, when you were talking about sports and joining, I've seen many occasions where everybody else rises up to the occasion and kind of
Absolutely.
is their best self and helps, your child. And there's a young man that I still take care of in his early 20s now. When he was about 10, I coached his basketball team, and
That's
he,
awesome.
he had Down syndrome. He was such a funny, funny kid. And it was his younger brother's YMCA team, who was the same age as one of my sons. And every time he came on, he'd come on for like a minute and a half, no defense, no passing, wanted to shoot 4 times,
I love
would
it.
raise his hands above his head and sprint back to half court, whether he made the shot or not. And everybody on the team would stop, basically, on
Sure.
the other team too. This was regular, like competitive basketball, and pass him the ball. People would be bent over laughing because he was just so joyful and
Yeah.
fun. He'd run across through the stands and high five everybody in the front row, and then he'd go sit down because he got tired, and we'd go back to playing again. And it was
I love
definitely way
that.
better than basketball when he wasn't on the court,
Yeah, I love
right? I
that.
mean, you don't know what's going to happen, just get
Yeah.
out there. And if it's bad, you might have to have a thick skin some days and move on, and you might
Yeah.
even be bad some days, but people will really surprise you. And I think if you are a coach, if you can be a little more flexible, patient, and really ask parents, whether you're a coach or a teacher or you have a gymnastics class, and or a martial arts class is a great example, because a lot of the senseis in the dojos are really focused on teaching you discipline. That's a big part of it. That means you got to wait in line, you got to do everything that you're told with military precision.
Yeah.
There are other dojos that will run, that have gotten used to working with kids with ADHD or autism and seeing the progress they make, and know that they might get to that, to be able to test out for their belt just like anybody else when they're at a blue belt, but they just need a little more support and flexibility up front. Or
Yeah.
maybe they arrive 15 minutes early, and the sensei goes through the routine with them and preps them so they know what's going to happen. I
Yeah.
mean, and then they do better, and they can wait for longer, or maybe they don't have to wait in line. They can go and sit down when the it's just talking, talking, talking that doesn't mean anything to them.
Yeah.
And I think that's the kind of thing, if you're a community member where you can really help children and families have positive experiences and help kids, like we said before, live their best life and learn skills. And like, it's going to be great when Logan moves up through belts, and he'll be proud of that, and he'll be able to tell people and show that. And
Totally.
he deserves that,
Yeah.
Yeah.
We've gotten so lucky with his little karate class. She does that. We come early when it's test out days and she goes out there with him and does it. And he's not always following along and it takes a little longer, but everyone cheers for him and they know. And it's just super sweet. So I love that. Uh,
Yeah.
I think, yeah, that's super important when it comes to the sports and all that for people to understand. I know we kind of talked about how we can kind of dismantle the stigma. I think a lot of that's just come up, just how it's just a cultural thing and it's just part of the human experience. But what is one thing that gives you hope, in the world of autism care today?
Yeah. This might sound funny because years ago I would have said, well, there's genetics or treatment or clinical trials, and it's really not that for me. It's the thing we were just talking about. That's what really gives me hope, that more people really understand autism. When I first started, we spent a lot of time, and I'm embarrassed to say this now, saying you can't stim in public. You have to, if you do hand flapping and don't make eye contact, you're not going to be able to get a job. And it wasn't me, but that was our kind of therapy goal.
Yeah,
That was the
yeah,
model. And it's so impossible. It takes so much energy sometimes if you're that autistic individual to, and it doesn't feel good either to stop doing those things when it just makes so much more sense for the rest of us to
Mhm.
see through some of the behaviors that might be distracting and just get to know somebody and support them. And I know it feels like there's a lot left to do, but we've really made progress in that area. And honestly, it's because of things like this. Like,
Yeah.
people are able to hear from other families now.
Hmm.
And socials, I think actually, socials aren't always great in the world, but I think they help in this area in podcasts
Yeah.
and because people can hear that they're going to be all right and that there's lots of positive experiences out there and they can hear like, oh, what would I do to support? Because a lot of it before I think was people just had no idea,
Yeah.
and there's some goals around treatment. We're getting better at, treating co-occurring anxiety, and there are clinical trials that it's still really early but for certain genetic conditions, we're getting, more clarity
Hmm.
on treatment and even creating some individualized treatments for some of the most severe forms that also have epilepsy and other conditions
Yeah.
that
Logan also
well,
has
to
epilepsy on top of
yes, yeah.
everything else. He's got an epilepsy diagnosis, and so does my brother actually too, which is
Yeah.
interesting. But yeah, Logan's got the autism, auditory processing, and the epilepsy thing we're navigating. So it's so interesting how things kind of categorize and fall kind of into different areas. So
Yeah, and I think that's the last thing I would just say. There's a lot of things that give me hope. There's just like our fellows and neurology residents, and they're
hmm
just trained in this specific area so much better than we were. Because when I was first in training, autism was like 1 in 1,000 kids, and everybody's so focused on how it's 1 in 31 now and what that means.
yeah,
One nice thing about that, one positive thing about that is when you see so many more kids, there's just so much more education that goes on. You got to learn more. You got to get better at it.
yeah.
An average pediatrician has 40 or 50 kids in their practice now, that they
Mhm.
follow. And I think they're better and better at it. So that's all that gives me hope, Kate. All of it
Yeah.
does.
Well, thank you so much. I think just in closing, I just want to leave parents with kind of we touched on a lot, and I think there's so many emotional factors that fall into, again, getting the diagnosis and what that kind of looks like, and what is something you tell families or that you would want them to kind of walk away with um, to help them feel kind of seen or heard.
I think in really in the most basic way, I want families to know that they can do it, that they're going to be all right, and that they are the person that's capable of supporting their child. They can learn what they need to learn. We'll help them get connected to services, but but that they can do it. And that kids do get better. A lot of times that's the toughest day, that day of
Yeah.
diagnosis, or at least it's a really hard day because it's
Mhm.
just so overwhelming, especially when I give you a list of 32 things you got to do, and
100%.
it's really overwhelming. And I think to not focus on that, and just like you said earlier, to focus on finding a couple support people and processing and then get going, after a couple weeks, and you need help. You're just going to need help with it.
Yeah. I love that. That's true. It is nice to hear that, have those positive words of affirmation that you can do it. It's going to be okay. One day at a time, one step at a
Yeah.
time, one goal at a time. I try to remind myself of that. I s- Now, the what goals do you want to meet by? And it's like, you know what? I want Logan to succeed. I want him to meet his goals, but we're going to meet them at Logan's time, and I'm not going to put a timeline on anything. And so if you can just be accepting that we are on their time and they are going to continue to grow and develop at the right pace, exactly how they're made to and they're meant to. And again, it is going to be okay. Hard days or not, it's going to be okay.
I love that. What you just said, that takes a lot of faith, and that's putting a lot of faith in him and in your family together. I really love that approach. That's
Yeah.
right.
Yeah. Well, thank you. I'm excited. I'm going to meet again with a colleague of yours for our next little episode. She's going to talk more about the services you guys have to offer. I know you guys do so much at the Mind Institute. I want to get into some of your adult services too at some point. I know when we first donated to you guys in 2021, you guys were starting your little collegiate program. I think you were taking 12 applicants and
Yeah, yeah.
helping them, find jobs, and you were job training on site and they were working the coffee shop. And there is just hope for the adult community too. And so many things that you guys have to offer. I just think you guys are great over at the Mind Institute. And It's
Thanks, Kate. You
great
should
to
see
work with
those
you guys.
guys. The Redwood Seed Scholars, sorry for interrupting, are on like
No,
year
you're
year
okay.
4 now. Like I have a young man. Like there's young folks we take care of that have Down syndrome, Fragile X, other
Yeah,
things, but they have jobs. They're doing things that are aligned with their interests. They have great hobbies. When I see them, they're like going hiking on the weekends and
yeah,
telling me about their job. They love sports, so they're at every sports game. Doing ticket taking and stuff,
yeah.
and they are living their best life.
They are, and there's when we move to the adult community too, there are job coaches and people out in the community that are working to kind of help support individuals too, and kind of coaching them and getting them prepped for jobs. And there is hope, and I think we need to do more helping businesses understand what
Yes.
that entails, because I think people again get a little reluctant when they hear somebody has a disability or autism or whatever, and they don't want to hire somebody, and there's a little bit of a stigma there, and that's a whole nother topic of discussion, but a whole another passion of mine. And I think that once we get that in the right direction, there's going to be a lot more hope for the adult community as well.
It's exciting. We have a business advisory council at the mine that trains
Yes.
businesses, and there's all these wonderful people that are really succeeding in work now, and
Yeah.
it's great for the people they work with too. And
Yeah,
so,
it is. You guys are doing so great over there. I just want to thank you again for all your years of service, all your work that you've put into your education and supporting our community. It's incredible all that you've done and all the families you've helped. So I know
thank
you
you,
probably
Kate. It was
mean
a
so
real
much
pleasure.
to
Thank
so
you
many
so much.
families. Thank you. Have a
Okay.
great day.
Okay, thanks. All right.
Bye.
Bye bye. Thank you so much. Okay.
You're welcome.